My name's Noel. I'm from CNSA, and today we're going to teach you about foley catheters and how to insert them. So let's start.
Is that good?
All right, so before you start, go ahead and make sure and verify the doctor's orders that there's a foley catheter for your patient. And then once you verify that you have to put in a foley catheter, gather all your supplies and then go to the room. Let's go. Okay, so you could cut. Knock, knock. Hi, Ms. Smith. I'm here to put in a foley catheter. Can you verify your name and date of birth? So you're gonna verify with them their name, date of birth. And once you have that, then you can go ahead and get started. So first, you're gonna want to close the curtains for privacy. And then you're going to raise the bed to a comfortable height, which is usually about elbow size. Since I'm tall, it's gonna go pretty high, but okay. So now if you're right-handed like me, you're gonna want to be on the patient's left side. It's gonna make it a lot easier. Put a bath blanket here. You're gonna put your patient like so. Now, you're gonna put on gloves and you're gonna start pericare. Of course, I'm gonna wash my hands first before putting on the gloves. But just for our demonstration, we're just gonna do it this way. So I'm gonna have lukewarm water here with a towel. And we're gonna start pericare here. I'm gonna put this water absorbent pad underneath so you don't mess up the bed, like so. Gonna clean from the side furthest from you. Go to the clean side of the towel and do the side close to you. You can rinse and then go ahead and finish down the middle, like so. And then you're done with pericare. Usually, in the hospitals, the Foley kit already has a pericare kit inside of the kit. Let me say that again. In the hospital, the Foley catheters have pericare kits already in them, so you don't have to bring in this basin, which makes it a lot easier. So away, get rid of our pericare stuff, and get rid of your gloves. And then wash your hands. Then you come with your foley kit here, and I recommend bringing sterile gloves, because usually the gloves inside, they're like 6s, so if you have bigger hands like I do, you're going to want to bring your 8s or 8.5s. You're going to take out your foley kit here, and out of the bag, what I like to do with that is treat that like a trash can. Makes it easier, makes it cleaner. Get rid of this stuff here. You start peeling it open. Go away from you. Just kind of turn if you have to. Grab only the corners, about 1 inch. What you could do is transfer this while holding those corners here. So now you still have a sterile field here. Now, go ahead and throw in your sterile gloves. That way everything's sterile to sterile.
Got canceled?
Alright, so now you have your sterile gloves on.
765 canceled?
You're going to grab the
Let me
drape
message Dr. Scudmore. Let me write it down first before I.
and only grab by the corners. You're going to open it up. Now there's a shiny side on the drape. That's going to go down. So you can grab the corners here. See that?
76745.
This side's a little bit shinier.
76745 is being canceled.
You're going to set
cancel.
it here. So that's your extra sterile field. You have an extra drape here. You don't need that. You can just throw that away. Those extra gloves that are in here, you don't need that either. So now you have a couple items here. You have your swab sticks, lubricating jelly, and your syringe with water. So what you can do is open up your swab sticks here, have it all ready. Take out the sticks like halfway. It makes it easier. You can open up this lubricating jelly and just kind of squirt it in there. And then for your Foley, just attach it here. And then take out this bag. Just make sure you hold on to the catheter so it doesn't just like whip out and hit outside the sterile field. Then you're gonna set that about 2 to 3 inches in the lubricating jelly. Once that's all lubed up, you just kind of keep it in the lubricating jelly. If I poured it out, it would stick there. So now that everything's ready here, now we go back to the patient. We're gonna dedicate one hand to the patient. This hand is no longer sterile, so you can't touch any of the equipment. You're gonna grab your swab sticks with your sterile hand, and you're gonna clean from furthest from you, from top to bottom. Go around your sterile field because you don't want to drop anything in there, and throw it away. Grab a new one, clean closest to you, top to bottom. Go around again, and grab your third swab stick and go from top to bottom and through the middle. And around one more time. Once you're done with that, go ahead and grab your catheter, and you're going to lift the bag and the catheter all together, closer to the patient. And you can go about 4 inches, or until you start seeing urine come into the tube. And then when you do see urine, go ahead and go 1 more inch deeper. Anchor it so it doesn't slip out. You're going to inflate the balloon with the water. And then once you do, go ahead and pull back until you feel some resistance. That means it's pretty much anchored and it's not going to go anymore. So now you're pretty much done. Put a stat lock onto your patient. Sign and date your Foley bag. You can take this off now.
Oh my gosh, they did drop one and it's just now showing up.
And then hang it onto the side. There's usually little side rails here. Just make sure nothing's coiled up so all the urine comes out nice and evenly. Make sure it's not like kinked or anything like that, because if you do, that urine's not going to flow and it's going to stay stuck inside the patient. And that's how you get UTIs. So once you have all that done, you're good to go, clean up, and your patient's ready. Don't forget to cover the patient, lower the bed as far as you can. Make sure the bed rails are up. And then just go ahead and ask them if they're doing okay. After that, you're good to go.